That's fair.
Welcome back. The next topic is one that is truly of life or death consequences. I'm excited to welcome to the program this morning Utah Government Relations Director Brooke Carlisle. We're going to be chatting about a legislative report card on how we as a citizenry and our elected representatives are tackling the issue of cancer prevention from a legislative perspective. Good morning.
Good morning. Thank you for having me.
Absolutely. Thank you for coming to discuss this topic.
Absolutely.
Right off the top, as we just said during the commercial break 2 seconds ago, I was a little surprised to find that the report card is not so great.
It's not. I think there's some clear room for improvement, to put it nicely. The report card looks at 9 areas, 9 policies dealing with cancer, and it really takes a stoplight approach. So every state gets a red, a yellow, or a green, depending on how they're doing. So Utah is green in 1 out of those 9 areas. So
wow,
safe to say, we could be doing better.
1 for 9 is not what you want for your batting average.
It's not.
And
no,
also,
no.
when we're talking about a report card for cancer
absolutely,
issues.
absolutely.
Tell us what the green light is.
The green is around smoke-free laws. So obviously the connection between cigarettes and secondhand smoke and cancer made many, many years ago with the Surgeon General's report. So I think everyone in Utah knows you can't smoke in a bar, you can't smoke in a restaurant, you can't smoke in the studio. So Utah does very well when it comes to clean indoor air and not being able to smoke indoors. So.
And the other 8?
The other 8 all deal with either access to cancer care or prevention of cancer before you even need care. So probably the most timely where Utah is red is the state has chosen not to expand the Medicaid program. So definitely red when it comes to access to Medicaid and choosing to expand that program. Also red when it comes to funding of the tobacco control program at the State Health Department, funding of the breast and cervical cancer program at the State Health Department, which provides cancer screening for women who don't have insurance. We're also yellow when it comes to allowing minors to use tanning beds. Tanning beds are not safe using at any level. And obviously, as a teenager, lots of teenage girls especially are tanning. So Utah has some room for improvement in those areas and others. Interesting.
A really funding issue overall, and of course that becomes really a larger issue of priorities. Are you involved in understanding the causality for that? Or is there sort of a backstory? And obviously you've laid out a number of different topics within the umbrella of cancer and prevention, but is there sort of an assessment that takes place in that regard?
I can't necessarily speak for the legislature, but I can give you my perspective. I think especially when it comes to tobacco funding, I think Utah is perceived as a healthy state. Like we were talking about, it's an outdoorsy state. Lots of people are not drinking, they're not smoking, they're generally living healthy lifestyles, they're physically active, they're doing all of those things. And I think, when I travel and go to other states, I see significantly more people smoking than I do in the state of Utah. So I think the thought is, 9% of the population smoke. That is, again, the lowest smoking rate in the nation. That I think there's a perception that tobacco it's not a huge issue. I would disagree with that. 9% is still a lot of people. It's still a very tough.
Yeah, if you look at the raw number.
Yeah, and it's a tough addiction to quit.
Very much so.
And so the more funding that goes to the State Health Department to help people do that, the better. The quicker we will lower that 9% to ideally 0%.
Indeed, and it occurs to me, and I have no statistical backup for this, but I think that there is a general correlation nationwide that, at least in this country, that socioeconomic classes that have less resources, folks who may not have had an opportunity to have a certain level of schooling, and I'm not going to say if that's a university diploma or whatever, but when you're sort of looking across statistical categories from who the smokers are,
absolutely,
and the people who need the most help. Now we're back to funding already,
absolutely,
with respect not only to prevention, but also, as you say, for individuals who have no health insurance, real health care, or ways in which to be able to pay for their own health care.
I mean, I think you've hit the nail on the head. We know, tobacco use rates are higher among disparate populations, whether that be, racial and ethnic minorities, people of lower socioeconomic class. Their tobacco use is higher, and it is, I think in part education and not understanding the dangers of tobacco use, and it's also not having access or being able to afford those cessation devices, whether it be the patch, the gum, being aware of the state quit line that can provide counseling to help people quit. So, it's across the board with cancer, not only tobacco use, but if you don't have access to the care that you need, you're not getting your mammograms, you're not getting your colonoscopies, you're not getting your screening, you're not catching cancer early when it's treatable, or in the case of colon cancer, preventable. So it's a slew. Access to care it's a big issue.
It's a big issue. And the other thing that occurred to me just as we were even beginning to talk is that, especially when you're talking about funding for programs where you mentioned cervical cancer, and I think the larger issue is care and attention paid to the unique situations for women.
Absolutely, absolutely. We know in Utah, women are not getting their mammograms at the rate they are across the country. And I think it's the million-dollar question as to why that is. It's not only uninsured women, it's women with insurance who have that access. They just aren't utilizing it. And I think we don't know exactly why that is, but I think, one of the thoughts is that it's the prevailing mentality of women putting themselves last. If you have a family to take care of and you have small children, it is hard to arrange getting to the doctor and getting that care, but we know, if you get a mammogram and your breast cancer or other cancer is caught early, your chances of recovery are so much better.
Vastly superior. And it occurs to me that that's a little hard to kind of put together in the same thought with the fact that, you could stop just about anybody on the street and say, breast cancer, and they'd say Susan G. Komen and the pink ribbon.
Absolutely.
And so, we use the word awareness so very much, and perhaps no other category of health risk has been as discussed and as put forward in our media as breast cancer and the importance of mammograms.
Absolutely. I mean, I think everyone knows what the pink ribbon means, whether you associate it with Susan G. Komen, whether you associate it with us at the American Cancer Society. Everybody knows what pink means. There's a lot of pink. Everyone knows a woman who has had breast cancer, either survived breast cancer or passed away from cancer. I think it's personal for everybody, but we need to take that next step of that translating into doctor's visits and prevention and early detection so that women are getting their cancer caught at an early rate or have the peace of mind and knowing that they're just fine for another year.
Yeah, peace of mind, huge. What can we do to help our legislators along?
I think you can't, as just your everyday Utah citizen, you can't underestimate the power of your voice. A phone call, a text, an email. Our legislative session is short. It's 45 days.
It is.
We have a citizen legislature. They have normal, quote unquote, normal jobs when they're not legislators. They're normal people. They're your neighbor. They're approachable. And if I don't tell them and you don't tell them and viewers don't tell them what's important, they're never going to know that people care. So, getting in touch with your legislator is not that difficult. Or at the American Cancer Society, we can do it for you. We can send you emails and let you know what issues are coming up that are relevant to cancer. But I think first and foremost, people need to pay attention. There might be a little bit of political fatigue But
question.
so much of what happens at the state level and the local level. The federal level is important, but what happens in your backyard is also very important.
And you can have so much more of an impact and influence there.
Absolutely, absolutely. But again, I think, there's probably a little bit of political fatigue in the country, but,
Sure.
I think people need to pay attention to what's happening up the hill in
Absolutely.
Salt Lake.
The hill. Well
Yes,
said.
up the hill.
Where should folks go to follow along with your work online, social media?
Yep, they can read the entire report if they want to at acscan.org. The Cancer Society is on Facebook. We are on Twitter at ACSCan Utah, so they can follow along there, and we would love for people to get involved.
I would love that too.
Yeah.
Viewers, there is some direct advice for you this
Yes.
morning. Brooke, so nice to meet you. Thank
nice
you
to
for the
meet
work that
you.
you do on behalf of patients and those who don't even know that they may yet one day become patients.
Yeah, you're welcome, and I'm happy to love what I do, so can't argue with that.
Good for you. Brooke Carlisle, American Cancer Society, make sure that you go and become involved. These are issues that we need to address. This is a continuing public health issue. Quick break, lots more after this. Please stay tuned.